Avascular necrosis of the femoral head is a common condition. It is commonly seen in patients who are taking steroids for a long time and people who consume alcohol. In majority of the patients, we don't know the cause for this condition, but it is a very bad disease which affects the hip joint and it usually affects the young reproductive age group, active, healthy, productive age group people. It is also called aseptic necrosis, is a bone condition that results from poor blood supply to an area of bone causing bone death. Necrosis means death. This is a serious condition because the dead areas of the bone don't function normally, are weakened, and can collapse. Aseptic necrosis is also referred to as a avascular necrosis or a osteonecrosis. Although any age group may develop osteonecrosis, most patients are between 20 and 50 years old with the average age in the late 30s. As I already told, it can be caused by alcohol or a long-term steroid intake, but exact cause is not known. It can be caused by trauma and damage to the blood vessels that supply bone its oxygen. Other causes of poor blood circulation to the bone include blockage of the blood by air or fat embolism that obstruct the blood flow through the blood vessels. Abnormally thick blood and inflammation of the blood vessels can cause a septic necrosis or avascular necrosis. Conditions that are associated with aseptic necrosis include alcoholism, cortisone medications, Cushing syndrome, radiation exposure. The disease, which has many causes, gets worse over time. Aseptic necrosis begins as a painless bone abnormality. It can remain painless. The involved bone often later develops pain, especially with use. For example, if a hip joint develops avascular necrosis in the ball of the hip joint, pain can be noted, especially with the weight bearing. As the ball of the hip joint collapses from the degeneration of the bone from aseptic necrosis, pain in the groin can be felt with the hip rotation and pain can sometimes be noted with the rest after weight bearing. The diagnosis of aseptic necrosis can often but not always be made with X-rays. By the time changes are apparently seen in X-rays, there has been a substantial damage to the bone affected. Bone changes visible on plain X-ray are therefore considered as a later stage finding. Earlier signs of avascular necrosis can be detected with MRI or a bone scan. Coming to the treatment of aseptic necrosis is critically dependent on the stage of the condition. Early aseptic necrosis can be treated with a surgical operation called a core decompression. This procedure involves removing a core of bone from the involved area and sometimes grafting new bone into the area. This allows new blood supply for preserving the bone. Weight bearing or impact of the involved joint is restricted for some time. Later stages of aseptic necrosis typically lead to seriously damaged bone and joints requiring joint replacement surgery.